Thank you all for joining us today. For those of you who don't know, my name is Biz Steinberg, and I do serve as the CEO of Capslo, and I've been here in the organization about 42 years.
Wow.
A few weeks ago, we did our first virtual tour for the Capslo board, and we wanted to open this next tour of 40 Prado to donors as well as the board members. So for those of you who are a little newer to our organization, I wanted to share just a few things. We serve individuals and families in 11 counties of California, including San Luis Obispo. San Luis Obispo, though, is our home county where all of our community action programs began. We run a variety of Head Start programs for thousands of young children and their families. In San Luis Obispo County, we offer a range of programs for people who are trying to become self-sufficient for all stages of the lifespan, from birth to senior citizens. Today, you will learn more about our homeless programs, but we also offer programs in health and prevention, teen wellness, energy, weatherization, and senior home repair, the Child Care Resource Connection, also programs for veterans, and we do have the only adult day center for people with dementia and Alzheimer's in the county for low-income individuals. We offer family care support services, which includes family preservation, parent education, and father involvement. We're going to continue offering virtual tours on a number of these programs in the coming weeks. And so we would like to invite you, if you're interested in hearing more about our programs, to put your name in the chat during the tour today. It's my pleasure to turn over our tour formally to Grace McIntosh, who is our Deputy Director here at Capslo and who's in charge of all operations at 40 Prado, the Homeless Services Center. Helping her, of course, to pull this video off, because she's going to be walking with us, will be our Executive Administrator, Marcy Spurlow, and also behind the scenes, Laura Mountain Toller. So, Grace, take it away. Thank you, everyone.
Hi, good afternoon. So I am appropriately socially distancing, so I'm going to take off my mask, but this is what we wear here at 40 Prado. These are unique times, so I'm really glad that you could all join us to see how we're doing here at 40 Prado, and we're doing very, very well. So I'm going to walk you through 40 Prado like I would if you were literally here in person, and I understand that there will be opportunities to answer some questions afterwards, right, Marcy? Okay. So we're going to kind of walk through. We're going to start here. This is our conference room. This is where we have meetings, various get-togethers, and it is a lovely, lovely space. So you saw me earlier, I think, at the front entrance, but we had some folks coming in at the time, so I wanted to get everybody kind of out of the way. But normally, when people first walk in, they do right now, they come here and they get their temperature read. We also look to see if they're appropriate to come in. Right now, we're having some special screenings with people that are here needing to be COVID tested. We are being tested once a week right now. And last week, everyone here was negative, 138 people. So we're very excited about that. So we're very, very vigilant about adhering to all the social distancing as much as possible. We do have our clients as well as our staff. They all are required to wear masks. So when you first come in, you would ideally be checking in with staff. Say hi, staff. They would check in to let you know what kind of services are available, make sure that if you have any mail, if it's mealtime, which right now it is lunch, you'd be going in and getting your lunch. Once you're done with that, you're free to go into the day room. Like I said, right now it's lunch, so everybody's in the dining room, and we'll get there eventually. One of our greatest partnerships that we have right now is with CHC. So CHC came on board as a partner shortly after we first opened, and there is an entire wing that is dedicated to the activities of both CHC as well as our therapeutic activities. So if you were to come in here and you were a patient, you would come into one of the two medical exam rooms, and turn the light on. It is a full services primary care exam room. So we have an MD, and we also have a physician's assistant, and services are now provided 3 days a week here. It's a really great opportunity because increasingly our population is becoming older and frailer, and the need to have an on-site facility such as this to address issues as they arise has become virtually required at this point. And you'll probably see a little bit as we kind of walk through the facility. We also have here, we have therapists, and actually we have one of our therapists is with the Slow Hub project. That project is for dually diagnosed individuals, folks who are kind of coping with substance use and mental health issues. And we are now in year 4 of a 5-year grant. It is funded through the Substance Abuse and Mental Health Services Administration. It's a federal entity, or SAMHSA. We have been very, very fortunate, and for the last several years, we have actually been deemed a high-performing grantee of the over 150 that are across the country. So we've been really fortunate because this is some of the most challenging folks that we can have. People that maybe aren't even staying here at 40 Prado, they're out in the community because they're not ready or not able to for whatever reason. That's okay, we meet them where they're at. And the purpose of this is to house them. And so ultimately we are doing tremendous work in getting them housed. Oftentimes that means sober living at first, but that's okay, whatever path is necessary to get them on the eventual path into permanent housing. So this is we're gonna go out of the CHC therapy corridor, and then we're gonna go over to our night wing. So during the day, the night dorms are not occupied because we hope that our people are out and about doing their business. We do allow our recuperative care clients here, though. And recuperative care is another great program. We've been doing it now for close to 5 years.
I saw the old one, but it's awful.
It is a partnership with Dignity Health and Pet Health Systems. We have 6 dedicated beds, hospital beds all, that are just for people that have been discharged from either one of the Dignity Health hospitals, French, or Rio Grande, even Marion, or one of the Tenet Health hospitals, so Sierra Vista or Twin. And these are individuals who would have nowhere else to go and need to safely recuperate. So in many cases, they're still on oxygen, they're in wheelchairs, they're very weak. And again, now you can see why having CHC here on site is so important, because oftentimes they need next day help, and we're able to give it to them. So it's great. So recuperative care is back here during the day. Otherwise, as I said, the dorms are pretty much empty during the day. And then this is our night area. So night staff would be stationed here to keep an eye on things as they go. We also have our recuperative care medroom, which is always locked if it's not occupied. That's because we do have recuperative care clients only, their medications, and we're very strict about how we take care of all of that. I can show you. Do you want me to open it up? Yeah? Okay. I think everybody's in there right now. Very quiet in here, but anyway. So it's very small, but as you can see, they're locked up. All the medications are locked up, and even within there, they're locked up even further. And we do have very strict protocols around shift change, where we do double counts. I mean, it is very, very, very strict. So this is the night area, and then that's our women's dorm area. And then this is our family dorm. So this is so cute. So about a year ago or so, I guess, now, Cal Poly students came and said, hey, what can we do? We want to do something for 40 Prado, and we're artistic, and we have these great ideas. And so we said, well, why don't you paint the walls of the family dorm? And so over like a couple of days, it actually came together. And I just think it's wonderful. We try to make this area as family friendly as we possibly can, hence, you know, the nice things on the wall, trying to keep it a little bit more homey. Families have their own 2 restrooms, actually, and I know this is a big thing for Biz. She always wants me to show this, so I have to make sure to show it. We have a little bathtub in there for kids. I wanted to make sure you saw that.
Bubble baths.
Bubble baths. When COVID first hit, we had a wonderful opportunity to work with the United Church of Christ, who was able to kind of reinvigorate their overflow system. For those of you that have known back in the old days, the old Maxine Lewis Memorial Shelter, you knew that we didn't have enough beds to house everyone. And so for almost 30 years, 12 churches, including one, the synagogue, alternated every month. A different church or the synagogue would take families every night. We would transport them from the Maxine Lewis shelter over to the facility. Every night, these families were transported back and forth and back and forth. Well, when we built 40 Prado, there was no longer any need to do that because we had our family dorms here. But when COVID first hit, UCC stepped up and said, hey, why don't we take the families and kind of bring back our old overflow just to get them out, just to keep them safe while you guys figure out what you need to do. They were amazing. And so we did that. So for several months, we transported, just like the old days, the families back and forth to UCC. That ended a couple of months ago, but I just wanted to give UCC a special shout out because that was really amazing what they did. And there's one of our little dorms. So if you just come right out here, the children have their own dedicated little play area. And it is really nice. It is often it is off limit. You just enjoy yourself, hang out, relax, rest, get some somewhat fresh air. It's a little bit better than it was last week with the air quality. We also, thanks to several wonderful volunteers, Patty Beck, mostly, who really made this kind of her vocation, is established a clothing closet. And so we do that in partnerships with several of the local thrift stores. And so Patty and her trusted group of warriors will go and get clothing and clean it and make sure it's in really good condition. And then we'll restock. So as people come, if they don't have clothes, and we have warming center coming up soon, people will sometimes come and they're literally drenched. So we'll go and get them some nice clothes. And she just takes care of that. And that's just been a really wonderful, wonderful addition to our program. We also have dog kennels on the other side of that fence. And we've actually had an opportunity to have some cats in there, amazingly. And then if you see the 2 big trailers back there, so that's a new addition thanks to COVID. The county was able to issue us a couple of trailers where individuals, while they are awaiting their COVID test results, will go there and they can be safe and away from everyone. And we have been really very, very fortunate in that we have had a very small number. And like I said, right now we are completely COVID-free as a group, which, considering the congregate care nature of this facility, is pretty amazing. We did, when COVID first started, we did decide to reduce our numbers in an effort to socially distance as much as you can in a facility such as this. So our traditional number of 100 went down to about 65 or so. We fluctuate, we go no more than 70. And we follow all the safe practices that CDC recommends, so head to toe, social distancing, the hand washing, and now we have that regular weekly testing. In fact, if you were still here in an hour and a half, you would see public health, because they will come in and they will set up and they test every single person in the facility, including staff. So we're really doing everything we can. Hi, sorry about that. So I am back in amongst people, so I am masked up again. Show you our kitchen. So this is our large community kitchen. It houses both Head Start activities as well as 40 Prado. So right now you see our amazing Lauren, who is unpacking some donations that we just recently got. And like I said, we're just finishing up
with lunch. So lunch is being served, so we're just finishing up with that. It is a great kitchen. It allows for about 425 Head Start meals to be cooked every day and transported to the children in our various Head Start sites throughout the entire county. And then there's a little bit of a break, and then we come in to begin prep for the evening meals.
Thank you, People's Kitchen.
Mary and her group thank you, have been amazing again throughout this entire time. They continue to come in and serve, and only just in the last couple of weeks have taken a little bit of a break. They do bring the meals, and hopefully starting later on this week, they will be able to come back in and provide the meals. One of the things that we have seen is a real drop in our volunteers. Part of that simply because our volunteers are older and they need to stay home and stay safe, but also because we have also looked to have as much of a safe environment here as possible. And so whenever possible, we want to keep people safe. So I understand that we kind of got cut off a little bit when it came time to talk about safe parking. So I'm going to take this off since I am now 6 feet away from everyone. So we started safe parking in 2009. We were the first organization to have that. We initially were across the street at 43 Prado. We had 5 spots. We expanded to 7 when we came over here. And then a few months ago, the county supported us in expanding to a total of 17 spots. The hope, of course, is when you come into safe parking, you are still looking for permanent housing. And so folks are staying in their cars for a variety of reasons, often because they're dealing still with trauma in their lives, or they're simply not comfortable coming into a larger congregate care setting, while they continue, though, to work with our case managers to look for permanent housing. So it is a permanent housing program. Okay. So we're going to walk through the dining room. And if you can you focus on those drawings? Yep. So I wanted to especially give a shout out to Chuck Krotzer and his wife Lois, who's also with People's Kitchen. And we had a wonderful participant here by the name of Mark, who is now housed at Judson Terrace through our case management program. But Mark was very proud of his art. And Chuck and he used to talk, and Chuck came up to me and said, hey, is there anything we can do to sort of display this amazing artwork? And I said, absolutely. So Chuck worked with Mark to get his drawings up on here, and we display them proudly. And we're very proud of what Mark accomplished, and very grateful that Chuck made it happen. So one of the other things that our participants do is that they run their laundry. And so when you need to have your laundry done, you come here, you give it to the laundry folks. They're on lunch break right now, and they carefully monitor your laundry and get it done for you in the same day. So it's really kind of neat because they really take it very seriously. And if you see some of the things here, only 2 loads per participant. We let them really operate this as they see fit, and they've done an amazing job. So this is our work study program, and we allow people to come in here and use the computer, play games if necessary. There's a small room in there where children and their families go when the kids are here later in the day. We have over 100 lockers that are available for both day use as well as for folks that are here at night that need some additional room to store their belongings. So they're each issue their own locker, and they can store their belongings in there. Mask comes off again. And we're back to where we started, back here in the conference room. So I didn't know if there were any questions that anyone had.
vegetable garden and
our vegetable garden. Okay, so when we first opened up, the city of San Luis Obispo employees came to us and said, you know, we would like to build you guys a garden that could help to provide vegetables and fruits to your kitchen. And so an incredible group of Slow City employees came out over the course of a couple weekends, and they built us, I think, 6 or 8 huge redwood boxes. Some of them were above ground and some were on the ground, and they planted a variety of vegetables, different kinds of lettuces, strawberries. They had other pots that they then put tomatoes in. We had zucchini, we had all kinds of herbs, and it was really, really wonderful. Clients took special pride in helping the city employees to take care of that. Obviously, with COVID, the folks from the city have taken a step back, and so some of our folks have sort of taken it on, and it has really helped. It's been very helpful, and it's also a very quiet place to sort of relax and kind of get your thoughts. Although, if you did notice, as we were walking down the night dorm, there was a lot of construction because RTA, who has purchased the large lot adjacent to us, has now begun construction on their large, I think it's a service yard facility, and it's going to be about 6 acres in total. And so there's a lot of construction going on, which is exciting. I mean, they've been a partner in the purchase of this 10 combined acres that we had. And so we're really looking forward to having them next door. So it's not so quiet back there right now. And then one other thing that I wanted to say, which is very, very exciting, is that we have finally put the final pieces together with our medically assisted withdrawal management program. The head of behavioral health doesn't like to call it a detox because she says it's so much more than that. But so I don't have to keep saying medically assisted withdrawal treatment program. I will call it the detox. We're hoping to break ground shortly after the first of the year with a hopeful construction close by about June of 2021. And that will be a freestanding 2,600 square foot building that will be located directly behind the trailers that I pointed out. And it will be 8 to 10 beds. They will be what we call flex beds. So it will be a combination of the classic kind of detox, which can be just a few days up to a week, but then an opportunity then to stay longer into residential treatment, 30, 60, or even 90 days. And this will be licensed by county drug and alcohol services, turn over the data needed in this county. You all know we don't have anything like that here in this county. And folks that really do want to detox and then get medically assisted withdrawal treatment, currently they have to go out of county, a tremendous cost and expense, as well as just expense in terms of their personal lives. Their family members, if they have any who want to support them, have to go then to another county. So this is really, really important, and we're very excited to have this in partnership with the county. So we still have great new, incredible things happening here at 40 Prado, because our whole desire has been that 40 Prado can be kind of a one-stop comprehensive place where people can then come and start their journey towards permanent housing. Veterans, okay. So we also have the Supportive Services to Veteran Families program. I oversee that program as well. That is a countywide program from Paso all the way to Avila Beach. We provide, again, it's a housing program, so working with veterans and their family members to get them permanently housed. So we have case managers. We also had a new program that started last year, which is an employment kind of training and support program for veterans. The outreach folks will come here and they'll meet with people who can meet the needs of their program. They will do all of the assessment, they will do the linking, and then they will work to get those individuals back into either employment or eventual permanent housing. So it's been a very, very successful program. Our goal in SSVF was to get to what we call the kind of zero functional homelessness. What that means is that even though we know that homelessness will never end as we know it, what we try to do is within 90 days, we try to house people so that we're housing people constantly. And our program has seen tremendous success, and that our average length of time now to house people is into the day 70. So considering how challenging it is to find housing here in this county, they're doing an amazing program. And speaking of how challenging it is to find housing here, despite all of this, I just did my board report for this month. We here at 40 Prado still were able to house 5 folks, including a family of 7. We're doing amazing work here. Since January, we have housed 91 individuals. Some of you may have heard that right now, vouchers are very, very challenging to get. We do anticipate when the moratorium ends, there will be a huge influx of people that are going to need help preventing eviction or who have recently fallen out of their housing. And so we're gearing up in partnership with some of our community partners. ECHO, 5 Cities Homeless Coalition are the primary partners, but to really look at helping people get back into housing as soon as they can, or ideally prevent them from being evicted. So that's a new sort of project that we're gearing up for. So we're constantly working with our partners to try and get people housed, but it's challenging here. Any other questions or comments?
I'm sorry. Go ahead. Grace,
Yes?
this, I meant to say Grace. This is Sandy Minji.
Hi.
First of all, good afternoon. Good to see your face. I miss you all. I want to just commend you, Grace, and our entire staff. It is so admirable, and in my opinion, nothing short of miraculous, the work that continues to be done. And I know I'm probably, quote, preaching to the choir, but to house 91 people in this current pandemic, and then to think that the number of individuals actually affected at 40 Prado has been minimal. I believe just 1. Is that still the correct number?
No, we have had, since this started, a total of 4.
Which is still remarkable.
It is.
So thank you.
It
Thank
is.
you. Thank you. The tour was informative. It was fun. I haven't been there for a while. I haven't been able to feed on Friday, and I miss you all. Thanks for your good job.
We miss you so much, Sandy. We miss all our volunteers. You know, it's been a very, very challenging time for staff and clients, and I am so proud of the staff and the clients because we're all in it together.
Absolutely.
I really thought that having our clients, the expectation of you have to wear your mask, but you know what? They were all fine. They all understood. We are in it together. There's no us versus them. This is all a community-wide effort, and the only way we're going to beat this thing is to work together as a community.
Well, absolutely. You continue to amaze. Thank you.
Grace, this
Well,
is,
they're amazing. They're amazing here.
Grace, this is Dee.
Hey, Dee.
Sandy said it. It's amazing. And when we think about, I think about you, our very first time we talked to people about building, and then about doing a building, and then we flubbed for a while, and then we got the idea and how long it took. And then to look at this place and how clean it is, and you know, it's great. I'm hoping that, are we filming this, Marcy? Are we filming this tour?
Yes, we are, Dee. We're recording it.
Okay, so are we putting it on YouTube, or how are we going to do it?
I'd
Yes,
have
we
to-
will. We will get it up on YouTube and share the link with you all.
Okay, good, because this is a good way to be able to say this is about a 40-minute tour, and you know, you don't have to leave your house to take a look at what's going on down there. And I tell you, we couldn't do it without Friends of Prado all these years. It's a, you know, it's one thing to build it, it's another to keep it funded, as we know.
Yes.
Absolutely. I mean, you know, the Friends, and there's been so much volunteer support, and Friends of Prado, as it was called before, was an amazing group of people that just came together over this shared common love of the community and of the homeless population, and has really grown as we have grown.
And there are so many volunteers that I could thank, but definitely, you know, some of the friends of 40 Prado now, folks who stay with us who maybe aren't on the board, like Roy Rawlings, and you know, and his wonderful wife Linda, of course Mary. We have so many amazing people that have come together and continue to stay with us, and that's really what we need. Is we need that community support now more than ever. So we just thank the friends, we thank our volunteers again, as Biz had mentioned, you know, Mary Parker and her amazing, you know, group at People's Kitchen, but also the quiet volunteers or the quiet people who just come and donate. I mean, when COVID first hit, we had an influx of donations that was just, I mean, just so humbling, of people that came and brought things like coffee and sleeping bags and towels and blankets and food, and it was just amazing. And they did it quietly. They just said, hey, I figure you guys probably need this. And then they left. And it was just such an amazing outpouring of community support. And that's really what it really is all about, because it can be, like I said, very challenging here. And oftentimes my staff kind of think, wow, how are we going to keep doing this? And they show up every day and they're happy to be here. And that's what humbles me tremendously, is their desire and their love to just be here and to show up. What do we need? Someone asked. Well, I've got Lauren right here next to me, and she's probably saying, you know what, more than anything, we need your financial support. You know, these are trying times. They're going to only get more challenging, I think, as government dollars will undoubtedly dwindle, because states and the local jurisdictions are going to be asked, if they haven't already started to tighten their belts, they will be tightening their belts. And so naturally the trickle down will be to the nonprofits. And so we need your financial support more than ever at this point. But we can also use things that translate also to financial support, things that we would otherwise have to purchase, things like coffee, constantly coffee, especially now that warming center is coming in. So we need to have that coffee going all the time. We can always use towels. We can always use milk. We can always use bread. We can always use breakfast items. We need another couple of 100-cup coffee urns. Those are quite expensive, actually. Laundry soap. I mean, really anything that you would think to run your own home, we need, but exponentially. So financial donations obviously are the most needed, but then household items would be much, much appreciated. And sleeping bags. We're always in need of sleeping bags.
And Grace, do we have storage space for this if somebody brings you a case of coffee?
We have storage space for a case of coffee, absolutely. What we don't have storage space for, unfortunately, right now is for furniture. Because oftentimes I will get calls saying, oh, we're moving and we have an almost brand new, you know, bed, or we have an almost new couch. And so we'll put it out in case any of our case managers or our SSVF folks are in the process of immediately housing someone. But unfortunately, we're not able to take large pieces of furniture because we don't have space for that. Paper towels, we can always use paper towels. We do go through a commercial type of paper towel. So again, financial donations. And if you want to make your donation specific to something, we do honor donor intent. So if somebody said, you know what, I want to give enough paper towels and toilet paper for a month to 40 Prado. Well, obviously we purchase those in bulk. So that we can be most efficient with our funding. And so we would always honor donor intent. And so if a donor says, I want my dollars to go specifically for this purpose, that is what that purpose will be for.
And Grace, do we make the checks out to Capslow and they go to Capslow, but you earmark them for 40 Prado?
40 Prado, right, 40 Prado. And then if you have something that you specifically want it to go for, either you can attach that in a letter or a card, or you can just write it at the bottom left-hand side of your check that I want this to go towards blank.
or on our website, www.capslow.org, donate.
Oh, yeah.
Grace, it's Biz. I know there might be a couple more questions, but I have to just congratulate everybody at the 40 Prado. But with your leadership, I'm sure everyone was stunned when you said you housed a family of 7. A family of 7 during COVID.
Amazing.
The miracles just keep happening. And the other that I'd like to share, you mentioned the SAMHSA grant. Grace spent 2 days in August virtually with her staff on the phone with the federal government because of the 150 projects, which she didn't say. Ours, she has worked for ours to be the top in the country. And they were speaking with her about, how do you do this? You know, how do you do relationships with behavioral health? How do you do relationships with the faith community, with the veterans? And I always say that CAPSLO, what I've so appreciated over the years is our relationship with the nonprofits, with government, with business, with volunteers, with our board, with our collaborating partners. You put all that together and you produce these miracles. So I just wanted to get my thanks into Grace, myself, as well as all of you for attending.